stop scrolling for just 1 second. Before you do anything else right now, I want you to notice something very specific. Notice your neck. Is your chin slightly dropped forward? Is your head tilted just a little to one side? Good. Now hold that thought, because what you just felt in 3 seconds is something your body is holding for 8 full hours every night while you are completely unconscious and unable to correct it. Most people over 50 spend years wondering why they wake up feeling worse than when they went to bed. Stiff neck, dull headache pressing behind the eyes, that heavy, foggy feeling that takes half the morning to shake off. A heart that feels like it skipped a beat or raced for a few seconds right when they stood up. And almost every time, they blame age, they blame stress, they blame the mattress. But here is what almost no one is telling you. The position your body settles into while you sleep, the angle of your head, the curve of your neck, the way your airway opens or closes, the direction your heart is tilted in your chest. These things quietly shape what happens inside your blood vessels for 8 hours every single night. And after 50, your arteries, your heart, and your brain are simply not as forgiving as they used to be. I am Dr. Megan Foster. I spent over 2 decades in surgical and vascular care, and what I want to share with you today is not something you will find on a mainstream health blog. This is physiology. This is what actually happens inside your body while you sleep, and why the positions most people have never once questioned could be creating real cumulative vascular strain over thousands of nights. We are going to cover 5 sleep habits that quietly increase stroke risk, 2 positions that are genuinely protective, 1 environmental factor almost everyone ignores, and a full practical plan you can start using tonight. I am also going to share things most doctors simply do not get to in a 15-minute appointment. Most of this prevention happens at home in the dark while you sleep. Stay with me. Because by the end of this, you are going to understand your own body in a way that most people never get the chance to, and that understanding could genuinely protect your brain for the long term. Let me start with the biggest misconception I see. Even in educated, health-conscious people, most people believe that stroke risk comes down to cholesterol numbers and blood pressure readings at the doctor's office. And yes, those things matter. But what most patients never hear is that stroke vulnerability builds at night. While you are sleeping, through oxygen dips, pressure shifts, and blood flow changes that happen in the quiet hours between midnight and 6 in the morning. Early morning strokes, the kind that happen right before or right after waking, are disproportionately common. There's a reason for that. It has everything to do with what your body is doing during sleep. And once you understand the mechanism, it changes how you think about every single night. Here is the simplest way to understand it. Your arteries are not rigid pipes. They are flexible, living tissue, more like a garden hose than a metal tube. When a garden hose is relaxed and straight, water flows through it easily. But the moment you bend that hose or press something heavy against it, the flow changes. You get turbulence. You get reduced pressure past the bend. In some cases, you get almost no flow at all. Now picture your neck. Running along both sides are the carotid arteries, the main highways carrying oxygenated blood from your heart up to your brain. When your head is angled too far forward, backward, or sideways during sleep, you are bending those hoses. Not dramatically, not in a way you would feel in the moment, but enough over thousands of nights to create real and cumulative strain on those vessel walls. And that does not even account for what happens with oxygen. When you sleep in a position that partially collapses your airway or restricts how deeply your diaphragm can move, your blood oxygen levels dip. Sometimes slightly, sometimes more significantly. Most people have no idea this is happening because they are asleep. But your blood vessels register every single dip. And over time, repeated small drops in oxygen create inflammation in the inner lining of your arteries. They trigger tiny spikes in blood pressure. They stress the heart in ways that accumulate quietly over years. This is how risk builds, not in one dramatic event. Over thousands of nights of small, invisible strain that nobody ever talks about. Now, before I go further, I want to share something about arteries specifically that most people do not know, because it changes how you think about all of this. Your arteries have a layer on the inside called the endothelium. It is incredibly thin, just one cell thick, but it is one of the most important tissues in your entire body. The endothelium controls whether your arteries can expand and contract in response to the demands your body places on them. It controls the stickiness of the blood vessel wall, meaning whether or not particles in your blood tend to latch onto it. And it produces a molecule called nitric oxide, which keeps your blood vessels relaxed, flexible, and open. When you are young, the endothelium is resilient. It can handle repeated small insults and recover. But after 50, this layer becomes more vulnerable. Repeated exposure to low oxygen, elevated pressure, and inflammatory signals from poor sleep begins to damage it. The surface becomes rougher. The vessel walls stiffen. And this is the foundation of the process that eventually leads to plaque, narrowing, and the conditions that cause strokes. Understanding the endothelium matters because it explains why the effects of poor sleep positioning are so gradual. You are not going to feel it tomorrow, but over 5 years, 10 years, 20 years, the cumulative damage to this inner lining is real and measurable and preventable. Now, let me share some research that really crystallizes this picture. A large multi-year sleep study published through the American Heart Association followed thousands of adults over 50 and tracked their nighttime oxygen levels alongside long-term cardiovascular outcomes. What they found was that abnormal nighttime oxygen levels and poor sleep quality significantly increased stroke risk, independent of daytime blood pressure, meaning people with perfectly normal readings at the doctor's office were still showing elevated risk because of what was happening in their bodies at night. A separate long-term study looked at adults with untreated sleep-disordered breathing, meaning partial airway collapse during sleep that they were completely unaware of. These individuals had a markedly higher rate of early morning strokes compared to people without this issue. The common thread was not cholesterol. It was not diet. It was nighttime physiology, oxygen instability, and vascular stress happening in the dark, while people slept in positions and conditions they had never once thought to question. And what I want you to understand about these studies is that many of these people were not in, obviously, poor health. They were ordinary adults in their 50s, 60s, and 70s who thought they were doing reasonably well, no dramatic diagnoses, but they had accumulated risk through habits nobody had ever pointed out to them. That is exactly why I want to walk you through this today. I also want to say something before we go into the habits, because this matters. I am not here to create fear. Fear is not a useful tool in health education. What I want to give you is understanding, because understanding leads to action. And the adjustments we are going to talk about are not dramatic. Most of them cost nothing at all. They just require awareness. And that is what this video is here to build. Before we go further, I want to ask you something. How do you usually sleep? On your back? On your side? Do you curl up tight? Drop it in the comments right now. Awareness starts with honesty, and you will be surprised how many people reading the comments realize they are not alone in what they experience every morning. We are learning this together. Let us start with habit number 5. This one affects your cardiovascular system before you even lie down, and most people underestimate it completely. Going to bed right after eating or drinking alcohol close to bedtime. People hear this and think a glass of wine helps them relax. And yes, alcohol does help you fall asleep faster. The problem is what it does after that first hour. Alcohol fragments a specific type of sleep called REM sleep. REM stands for rapid eye movement, and it is your deepest, most restorative phase. This is the phase where your heart rate and blood pressure go through natural, healthy regulatory cycles that repair and stabilize your cardiovascular system overnight. When alcohol disrupts REM sleep, it disrupts this regulation. Heart rhythm becomes less stable. Blood pressure, instead of dipping as it should during sleep, stays elevated or fluctuates unpredictably. And this disruption does not just happen on the nights you drink. Research shows the cardiovascular effects of regular late-night alcohol consumption compound over weeks and months. Late meals create a different problem. When you eat close to bedtime, digestion keeps your metabolism running in a way that elevates both blood pressure and core body temperature. Some people experience acid reflux as well, which sounds like a purely digestive issue, but actually triggers nervous system responses that can disrupt heart rhythm. Studies in adults with cardiac risk factors have shown that late-night eating correlates with a higher rate of cardiovascular events, including stroke-related events. The practical shift is simple. Finish your last large meal at least 3 hours before bed, and be honest about what counts. A snack high in sugar or fat, eaten 30 minutes before lying down, still activates digestion at a time when your body should be winding down. For alcohol, even 1 to 2 drinks within 2 hours of bedtime can measurably reduce sleep quality and increase nighttime heart rate variability in adults over 50. That does not mean you can never have an evening drink. It means if you are waking up foggy, stiff, and unrefreshed, the evening drink may be playing a bigger role than you realize. Now, habit number 4, and this one genuinely surprises people because it seems like such a thoughtful, supportive thing to do. Using too many pillows. People stack 2, 3, sometimes 4 pillows because they believe more support means more comfort. But when you pile pillows under your head, your neck bends forward. Your chin drops toward your chest. This position is called cervical flexion. And when you hold it for 7 or 8 hours, a few specific things happen. First, the muscles at the back of your neck are under constant stretch. This is why you wake up with a stiff neck and shoulders after a night on stacked pillows. But more critically, forward flexion of the neck alters the geometry of the carotid arteries and the vertebral arteries, which run through your spine and supply blood specifically to the back of your brain, including regions that control balance and coordination. The flow dynamics change. You get increased resistance in those vessels. And if you already have any narrowing in these pathways, which is a more common after 50 than most people know, that resistance matters significantly. Second, when your chin drops toward your chest, your upper airway naturally narrows. Your tongue and soft palate shift backward in response to the head angle. For people who snore or have any mild breathing difficulty during sleep, stacked pillows make this measurably worse. The ideal setup is one supportive pillow that keeps your head and neck in a neutral position. Neutral means your spine runs in one continuous line from your lower back to the top of your head, with your chin neither tucked down nor lifted up. If you are a side sleeper, your pillow needs to be thick enough to fill the space between your ear and your shoulder, keeping your head completely level. If you need elevation for acid reflux or breathing, the correct way to achieve it is by elevating your entire upper body using a wedge pillow under your torso or by raising the head of your bed. This keeps the neck in a neutral position while tilting the whole body upward. That is a completely different mechanical result from stacking pillows under your head. Habit number 3, sleeping in an extreme fetal position. And I want to be clear here before I explain, because a gentle side curl is actually one of the safer sleep positions, and I will tell you exactly why later. The issue is specifically the extreme version, where the knees are pulled tight to the chest and the body is compressed into the tightest possible curve. The biggest issue this creates is in breathing mechanics, and here is why that matters so directly for your brain. Your diaphragm is a large, dome-shaped muscle sitting just beneath your lungs. When it contracts and flattens, it creates the pressure difference that pulls air into your lungs. For it to do this effectively, it needs room to drop downward. When you curl tightly, you compress the space between your ribs and your pelvis, and the diaphragm simply cannot travel as far as it needs to on each breath. The result is shallower breathing across the entire night. Now, here is the part most people never connect. Every cell in your brain needs a steady, uninterrupted supply of oxygen. The brain makes up roughly 2% of your body weight, but uses about 20% of the oxygen you breathe. It has almost no reserve. If oxygen delivery drops even slightly, the brain responds immediately by attempting to regulate blood flow, which means your blood vessels are working in a reactive mode rather than a resting mode across the entire night. Over weeks and months of shallow breathing during sleep, this chronic low-grade oxygen stress drives inflammation in the arterial walls. It raises baseline blood pressure, and it accelerates the stiffening of blood vessels that we want to prevent. There is also a lesser-known factor here. Extreme curling compresses the lymphatic vessels in the chest and abdomen. The lymphatic system is part of your body's waste clearance and immune network, and it works largely through gentle physical movement and breathing-driven pressure changes. When you are locked in a tight curl for hours, this flow is restricted. Inflammatory byproducts that should be draining away accumulate instead. The fix is straightforward. If you prefer sleeping on your side, let your body settle into a gentle, open curve. Keep your knees at roughly a 90-degree angle or slightly more open rather than drawn to your chest. A body pillow placed in front of you gives your arms and top knee something to rest against, allowing the body to relax outward rather than curl inward. Now we are moving into the habits with the most direct impact on overnight brain circulation. These next two are things people do every single night, completely convinced they are fine. Habit number 2, sleeping flat on your back with no elevation. Back sleeping is often recommended, and I understand why. It distributes body weight evenly and keeps the spine in a relatively neutral position. But for adults over 50, particularly those with any cardiovascular risk, sleeping completely flat has a specific and underappreciated downside. When you lie flat, the structures of your upper airway, your tongue, your soft palate, and the muscles at the back of your throat become more susceptible to partial collapse under their own weight. In younger people with strong muscle tone, this is not much of an issue. But after 50, airway muscles lose tone gradually. The tissues relax. Even people without any diagnosed sleep condition can experience repeated partial airway narrowings that reduce oxygen flow for several seconds at a time throughout the night. These narrowings are usually subtle enough that people sleep right through them. They do not always cause loud snoring, but each one generates a small oxygen dip, and each oxygen dip triggers what researchers call a microarousal, a tiny moment of partial waking in the brain that disrupts the sleep cycle without any conscious awareness of it happening. The result is that you cycle repeatedly out of deep sleep and back into lighter stages without ever knowing it. You spend your night in a kind of shallow, fragmented sleep that feels like sleep but does not deliver the physiological recovery your cardiovascular system needs. I also want to mention something about heart rate variability here, because this connects directly to flat back sleeping, and it is something not nearly enough people know about. Heart rate variability is the natural, healthy variation in the time between heartbeats. A heart that is well rested and well regulated does not beat like a metronome. It varies rhythmically, and this variability is actually a sign of a healthy, responsive nervous system. High heart rate variability is associated with lower cardiovascular risk, better stress resilience, and longer life expectancy. Low heart rate variability is a known predictor of cardiac events. During deep sleep, heart rate variability is naturally at its best. The part of your nervous system responsible for recovery and repair, called the parasympathetic system, dominates during deep sleep, and it is what produces healthy heart rate variability. When flatback sleeping prevents you from reaching or sustaining deep sleep, you lose those windows of optimal parasympathetic dominance. Your heart rate variability suffers. And over time, this is a measurable cardiovascular risk. The fix is a slight elevation of 10 to 20 degrees at the upper body. A wedge pillow under your torso works well. Bed risers under the legs at the head of the bed achieve the same result. This slight angle keeps the airway more open, stabilizes oxygen, and allows the deeper sleep stages and the heart rate variability that comes with them to proceed without interruption. Now, the number one risk habit I see in otherwise healthy adults over 50, the one that consistently surprises people the most, consistently sleeping on the right side when you have any degree of cardiac or vascular risk. Let me explain the physiology carefully because the mechanism is specific, and understanding it is what makes this recommendation stick. Your heart sits slightly left of center in your chest. It is not a perfectly symmetrical organ. The right side of your heart receives blood returning from the body and pumps it to the lungs. The left side receives freshly oxygenated blood from the lungs and pumps it out to the entire body, including the brain. The efficiency of this whole circuit is affected by the position of the heart within the chest, and the heart's position shifts depending on which side you sleep on. When you sleep on your right side, the heart moves slightly in that direction. The surrounding tissue and the weight of the left lung create a subtle but real compression effect. This alters what is called venous return, the rate and ease with which blood flows back into the right side of the heart from the body. When venous return is even slightly impaired, the heart has to work a little harder to maintain its output. For a young, healthy heart, this is not a meaningful burden. For a heart with any early stiffness, any valve involvement, or any weakening of the muscle, this extra nighttime workload adds up over months and years. Left side sleeping allows the heart to rest in a position that preserves its natural geometry. Blood returns more easily. The workload during the overnight recovery window is lower. And this difference in cardiac workload during sleep is something vascular specialists have observed clinically for years, even as the research has caught up to document it formally. But there is another dimension to left side sleeping that is equally compelling, and it has to do with a system inside your brain that most people have never heard of. During deep sleep, the brain runs its own internal cleaning cycle. The spaces between brain cells expand by as much as 60% compared to when you are awake. Cerebrospinal fluid, the clear fluid that surrounds and protects your brain and spinal cord, is then pumped through these expanded spaces in a rhythmic, pulsing flow that is synchronized with your heartbeat. As it moves through, it carries metabolic waste products away from brain tissue and out toward drainage pathways that connect to the lymphatic system. Scientists call this the glymphatic system, and it is one of the most important discoveries in brain science in the last 20 years. One of the waste products it clears is a protein called amyloid beta. When amyloid beta accumulates in the brain over years and decades, it is directly linked to the development of Alzheimer's disease. Another is tau protein, also connected to neurodegeneration. The brain produces these proteins as a natural byproduct of its daily activity, and the glymphatic system's job is to wash them out every night before they accumulate to harmful levels. What researchers have found is that this glymphatic drainage is not equally efficient in every sleep position. The flow of cerebrospinal fluid through the brain appears to be most effective when the body is resting on its left side. The angle and direction of flow in this position align better with the natural pathways through which cerebrospinal fluid drains out of the skull. This means that left side sleeping is not just protective for your heart. It may be one of the most important things you can do to protect the long-term health of your brain. Now, I know what many of you are thinking. What if sleeping on your left side is uncomfortable? This is completely valid, and I hear it often. Forcing yourself into a position that keeps you awake or that disrupts your sleep creates its own cardiovascular problems because poor sleep quality from discomfort drives up cortisol, raises nighttime blood pressure, and prevents the deep sleep stages that the body needs. The goal is not rigid perfection. The goal is gradual, consistent improvement. To train yourself toward left side sleeping, a body pillow placed along your back is one of the most effective tools available. It prevents rolling over without any muscular effort to maintain position. Some people place a firm, regular pillow against their back instead. The process takes time. Even spending the first half of the night on your left side before naturally rolling over represents real progress, and the benefits accumulate even with partial adoption. Now, let me talk about something that ties all of these habits together in a way that most people never learn: the role of the vagus nerve in sleep and cardiovascular health. The vagus nerve is the longest nerve in your body. It runs from your brainstem all the way down through your neck, through your chest, and into your abdomen. It is the main highway of your parasympathetic nervous system, the system responsible for rest, recovery, and repair. When the vagus nerve is well supported and well functioning, it regulates heart rate, controls inflammation, coordinates digestion, and plays a central role in the quality of your deep sleep. During healthy sleep, the vagus nerve is highly active. It is what causes your heart rate and blood pressure to drop appropriately. It is what allows the body to shift into repair mode. And it is what controls the natural anti-inflammatory signals that protect your blood vessels overnight. Now, here's what matters for our conversation. The vagus nerve runs directly through your neck. When your neck is in a compressed or abnormally flexed position during sleep, whether from too many pillows, an extreme sleeping angle, or a poor mattress that allows the head to drop, the physical pressure on the tissues surrounding the vagus nerve can subtly interfere with its signaling. This does not happen in a dramatic way, but over thousands of nights, even a modest reduction in vagal tone during sleep has real consequences for heart rate variability, for the depth of sleep stages achieved, and for the overnight anti-inflammatory processes that protect your vascular system. This is one more reason why neutral neck alignment during sleep is not just about comfort. It is about keeping the pathways of your autonomic nervous system unobstructed so they can do their job while you rest. Let me now talk in depth about something I mentioned earlier but want to return to: nighttime blood pressure and why it matters far more than most people realize. Most people know their daytime blood pressure number. They get it checked at appointments. Maybe they monitor it at home. But nighttime blood pressure is a different physiological story, and research consistently shows it is a stronger predictor of cardiovascular events than any daytime reading. Under normal, healthy circumstances, blood pressure dips 10 to 20% during sleep. This is called nocturnal dipping, and it is not a passive process. It is actively coordinated by your nervous system, your hormones, and the state of your blood vessels. The cardiovascular system uses this lower pressure window to repair the inner lining of blood vessels, reduce localized inflammation, and allow the heart muscle itself to recover from the demands of the day. When nocturnal dipping does not happen, which is called non-dipping in clinical terms, the risk of stroke, heart attack, and kidney damage increases substantially. Studies have shown that non-dipping blood pressure is a more powerful predictor of cardiovascular events than elevated daytime pressure alone. And the connection to sleep quality is direct and documented. Every time sleep is fragmented by an airway narrowing, an oxygen dip, positional discomfort, or a microarousal, the nervous system briefly activates its stress response. Blood pressure ticks up, and the nocturnal dip is disrupted. If you are ever in a position to request a 24-hour ambulatory blood pressure monitor from your doctor, one that records readings automatically throughout both day and night, I would encourage you to consider it. Some people who appear to have well-controlled blood pressure during the day have significant nighttime elevation that is completely invisible in standard office readings. This is called masked hypertension, and it carries a substantially higher stroke risk than daytime hypertension that is actually detected and treated. Now, let me tell you about something else that happens during sleep that almost nobody discusses, and that is what your blood itself is doing overnight. Your blood contains cells called platelets. Platelets are responsible for clotting, which is a vital process when you have an injury. But in the context of cardiovascular disease, platelets that are overly activated can contribute to the formation of clots inside blood vessels, which is one of the direct causes of stroke. Platelet activity follows a daily rhythm. In the early morning hours, roughly between 4 in the morning and noon, platelet stickiness and aggregation naturally peak. This is part of the same biological pattern that produces the morning blood pressure surge. And it is another reason why early morning strokes are so disproportionately common. The blood is, in a sense, at its most primed to clot during that window. What affects overnight platelet activity? Several things we've already discussed: oxygen instability, fragmented sleep, and elevated nighttime blood pressure all contribute to a state in which platelets are more reactive by morning. Sleep positions and habits that stabilize oxygen and support deep sleep help modulate this platelet response. It is one more layer of the picture that shows why what happens during those 8 hours at night genuinely matters to your vascular risk the following morning. Let me also talk about hydration, because it connects to platelet activity and blood viscosity in a way that is directly relevant here. Most people do not drink much water in the hours before bed, partly out of concern about waking up to use the bathroom. And that concern is understandable. But the result is that many adults over 50 are mildly dehydrated by the time they go to sleep. And this mild dehydration persists and deepens through the night as the body loses fluid through breathing and natural processes. When you are mildly dehydrated, your blood becomes slightly thicker and more viscous. Thicker blood requires more force to pump through the same vessels. It moves more slowly through smaller capillaries. And platelets in thicker blood tend to aggregate more readily. This is not a dramatic medical emergency in a single night. But consistent mild overnight dehydration is a real and modifiable factor in cardiovascular risk that almost no one talks about. A simple adjustment is to drink a moderate glass of water about an hour before bed, rather than right before lying down. This gives your kidneys time to process it before sleep, reducing nighttime bathroom trips, while still ensuring your blood viscosity stays in a healthier range through the overnight hours. And drinking a glass of water relatively early after waking is one of the best first steps you can take in the morning before coffee to restore hydration and support healthy blood flow during that high-risk early morning window. Now let me bring in the environmental factors, because these work together with everything we have discussed, and they are easier to change than most people expect. Room temperature. Your core body temperature needs to drop during sleep. This drop is not just a side effect of sleep. It is one of the actual triggers that moves your brain into its deeper stages. The body cools and deep sleep follows. If your bedroom is too warm, this cooling cannot happen effectively. You stay in lighter, less restorative sleep stages. Your heart rate remains slightly elevated. Nocturnal blood pressure dipping is blunted. And the deep sleep stages that allow both glymphatic drainage and cardiovascular recovery simply do not arrive in the way they should. The ideal sleep temperature for most adults is between 65 and 68 degrees Fahrenheit. This feels cooler than most people expect, because the temperature that feels comfortable while you are sitting still and awake is higher than what your sleeping body needs. If you share a bed with a partner and temperature preferences differ, a fan aimed at your side of the bed, or breathable layered bedding that can be adjusted individually can help manage this without disruption. There is also a meaningful connection between bedroom temperature and inflammation. Sleeping in a consistently warm environment is associated with slightly elevated inflammatory markers by morning. Given that vascular inflammation is one of the primary drivers of arterial damage over time, this is not a detail to dismiss. Darkness and melatonin deserve real attention here as well. Most people think of melatonin as a supplement, something you take in pill form if you cannot sleep. But your body produces its own melatonin, and it does so in response to darkness, specifically to the absence of light reaching the eyes. This natural melatonin is not just a sleep signal. It is an antioxidant that directly protects the inner lining of blood vessels. It helps regulate blood pressure through the night. It suppresses certain inflammatory pathways, and its production is exquisitely sensitive to light, even at low intensities. A phone charger glowing across the room, a streetlight coming through thin curtains, or the standby indicator on a television, are all enough to meaningfully suppress melatonin production. Blackout curtains or a comfortable eye mask are inexpensive solutions that can make a real difference to both melatonin levels and sleep depth. And the habit of using a bright phone screen in the 30 minutes before bed is particularly disruptive because the short wavelength blue light emitted by screens is the most potent suppressor of melatonin production. It can delay and blunt the melatonin signal for several hours, meaning the early stages of your sleep that night are already compromised before you even close your eyes. Now, let me spend some time on the morning itself because the transition from sleep to waking is a physiological event with real vascular implications that most people have never been told about. There is a well-documented phenomenon called the morning blood pressure surge. In the 1 to 2 hours after waking, blood pressure rises rapidly as the body transitions from its overnight resting state to active wakefulness. Cortisol, your body's primary alertness and stress hormone, surges steeply in the early morning hours as part of your natural daily rhythm. This cortisol surge, combined with a simultaneous rise in other hormones like adrenaline, drives a rapid increase in both heart rate and blood pressure. For most healthy people, this is a manageable and normal transition. But for people with any degree of arterial stiffness, vascular disease, or poorly controlled blood pressure, this morning surge is when things become genuinely dangerous. The combination of suddenly activated platelets, rising blood pressure, and blood that has been sitting relatively still and slightly thickened overnight from mild dehydration creates a window of elevated risk. This is why a disproportionate number of heart attacks and strokes occur in those first 2 hours of the day. What you do in those first few minutes after your alarm goes off matters more than most people realize. Do not sit bolt upright immediately. Take 30 seconds to let your body begin adjusting while still lying down. Then sit at the edge of the bed before you stand. This small transition gives your cardiovascular system time to redistribute blood flow and begin regulating pressure more gradually, rather than demanding an immediate jump from horizontal rest to full vertical activity. Do not reach for your phone the moment you wake up. The sudden influx of notifications and the cognitive demand of reading and processing information activates your stress response before your body has even finished transitioning out of its sleep state. Your cortisol is already surging. Adding a cognitive and emotional stressor on top of that amplifies the morning blood pressure spike in ways that are entirely avoidable. Drink water before coffee. As we discussed, mild overnight dehydration is real for most adults, and rehydrating early supports healthier blood viscosity during that high-risk morning window. And then, regarding coffee specifically, caffeine reaches peak concentration in your blood within roughly 45 minutes to an hour of drinking it. If you drink coffee immediately upon waking, you are layering a compound that actively constricts blood vessels and raises heart rate directly on top of an already elevated cortisol surge. For people with vascular risk factors, delaying that first coffee by about 90 minutes after waking, once the cortisol surge has naturally peaked and begun to fall, can meaningfully reduce the cardiovascular load during the most vulnerable window of the day. This is a small timing adjustment that requires no other lifestyle change and costs nothing. Done consistently, it reduces the daily cumulative stress on your vascular system in a way that is worth taking seriously. Now, let me bring everything together into a clear, practical plan because I want to leave you with something specific and immediately usable. For the next 30 days, I want you to try these adjustments and simply pay attention to how you feel. Finish your last large meal at least 3 hours before bed. Keep alcohol at least 2 hours away from sleep. Start moving toward left side sleeping, even beginning with just the first half of the night. Try elevating your upper body 10 to 15 degrees with a wedge pillow or raised bed head. Bring your bedroom temperature down into the 65 to 68 degree range. Make the room as dark as reasonably possible. Avoid bright screens in the 30 minutes before bed. Drink a moderate amount of water about an hour before lying down. And in the morning, take 30 seconds before standing, drink water before coffee, and delay that first coffee by about 90 minutes. Each morning, check in on 4 things: Your mental clarity in the first 20 minutes after waking, any head pressure or headache, your energy level at mid-morning, and any heart sensations like racing, skipping, or heaviness. These are simple, free self-assessments that give you real information about whether your overnight physiology is improving. Many people who make these combined adjustments notice meaningful changes within 2 to 3 weeks. Fewer morning headaches, more sustained energy, clearer thinking earlier in the day. These are not placebo effects. They are signals that oxygen stability improved overnight, that your cardiovascular system received more genuine rest, and that your brain had the conditions it needed to run its maintenance cycle properly. Some people also notice that their mood is more stable and their anxiety levels reduce after making these changes. This is not coincidental. Deep sleep directly regulates the brain's emotional processing systems. When sleep quality improves, emotional resilience follows relatively quickly. I also want to be clear about when these self-management strategies are not enough and when professional evaluation is genuinely necessary. If you snore loudly and consistently, if a bed partner has ever witnessed you stop breathing during sleep, if you wake up gasping or choking, if you have persistent, severe morning headaches, if you wake with swollen ankles, or if you have ever had any episode of sudden numbness, sudden weakness, vision changes, or difficulty speaking even briefly, please do not rely on positioning adjustments to address these. These symptoms require medical evaluation by a qualified provider without delay. Sleep apnea is significantly undertreated in adults over 50, largely because the symptoms develop so gradually that people mistake them for normal aging. Sleep apnea is a well-established, independent risk factor for stroke, heart disease, and cognitive decline. If you have it and it is treated, whether through CPAP, a dental device, or another approach, the reduction in cardiovascular risk can be substantial. And a sleep study can now often be completed at home with a small device your doctor prescribes. It is not disruptive. The information it provides can genuinely change what you understand about your own health. Let me close with something important. You are not fragile. The body over 50 is not a declining system. It is a system that has adapted across decades and remains remarkably capable of improvement when given the right conditions. The vascular system responds to its environment. Blood vessels that have been under cumulative strain can experience real, measurable improvement when that strain is reduced. That is not optimistic thinking. That is documented physiology. Stroke prevention at its most practical level is not a dramatic intervention. It is quiet, consistent adjustment. It is the accumulation of decisions made in the dark, in the hours nobody sees, that add up over years to either protection or risk. And you are far more in control of those decisions than most people ever realize. The fact that you watch this through to the end matters. You now understand your arterial lining, your glymphatic system, your vagus nerve, your platelet activity, your nocturnal blood pressure, and the morning surge in a way that most people never get the chance to. That understanding is not just information. It is the foundation of action that protects the brain and heart you are depending on for decades to come. In the next video, I'm going to go deeper into the morning blood pressure surge specifically, covering the coffee timing connection, the cortisol rhythm, and what to do in that critical 90-minute waking window to protect your vascular system every single day. It is one of the most practical and underexplored areas of cardiovascular prevention, and I want to give it the full attention it deserves. If you want a complete framework for reducing vascular inflammation, protecting brain health after 50, and understanding the daily rhythms that either protect or quietly damage your cardiovascular system, my longevity guide is linked in the description. It brings everything together into a single practical resource you can move through at your own pace. You have found the right place. If you are looking for calm, honest, science-based information without extremes, without fear, and without oversimplification. This is about understanding your own physiology so that the decisions you make every day and every night are ones that genuinely serve you for the long term. I will see you in the next one.